This is Dr. John Bennett of Parkinsonism TV. Tonight we have another in a series of Parkinsonism issues with world-renowned educator Dr. A.Q. Rana of Toronto, a neurologist from Toronto. And tonight he's going to talk about constipation and Parkinsonism. Good evening, Dr. Rana.
Good evening, Dr. Bennett. How are you doing tonight?
Very good, very good. Okay, we'll start things off with, I'll ask some questions here. What is the relation between constipation and Parkinsonism?
Constipation is a quite common complaint by patients with Parkinson's disease, and more than 2/3 of patients develop constipation sometime in the course of Parkinson's disease. The frequency of bowel movement is different from person to person, and the bowel action does slow with Parkinson's disease, so the feeling of constipation may be individual. Some people may feel that they are constipated even if they have bowel movement twice a day, and other people may not feel that they are constipated even if their bowel movement is twice a week. So this is an individual feeling. However, sometimes the trouble with constipation may start much before the other symptoms of Parkinson's disease. And as Parkinson's disease advances, the trouble with constipation may become worse. Some of the medications which we use routinely for Parkinson's disease treatment, although they are used less commonly these days, they may cause constipation, such as anticholinergic, trihexyphenidyl, and cogentin, etc. As I said before, constipation may start sometime before the other symptoms of Parkinson's disease, and at other times it could be a presenting symptom of Parkinson's disease. Indeed, I had a patient in 2006. I saw this gentleman. He did not have a bowel movement for about 10 days in the beginning, before he had any other features of Parkinson's. So he decided to see his family physician. So this person was having low back pain as well. The family doctor thought that the low back pain was a spine-related issue which could cause change in bowel and bladder function, which was a right thinking. So he referred to a spine surgeon. The spine surgeon looked at it, and he thought the spinal stenosis he has was mild, and this was not causing constipation. So for pain management, he was sent to a neurologist. When the neurologist saw, so she noticed some decreased facial expression, and he was referred to our clinic, and this is how he was diagnosed with Parkinson's disease. Some of the research studies have looked at patients, and they compared those who have less than 1 bowel movement per day with those who had 2 bowel movements per day and more than 2 bowel movements per day. When they compare those individuals who had less than 1 bowel movement per day to those who had 2 bowel movements per day, there was an increased risk of development of Parkinson's disease in those patients who had bowel movement less than once a day. The exact cause of constipation in Parkinson's disease patients is not known. There is a relation of autonomic dysfunction with this problem. The intestines are supplied by the Meissner and Meinteric plexus, and there is some dysfunction of this plexus in these patients. Also, the Lewy body pathology, which we see in brain in Parkinson's disease patient and is considered a hallmark of Parkinson's disease, has been noticed in the neurons of these patients who are constipated and they develop Parkinson's disease. These patients usually have an outlet type of obstruction. Their constipation is an outlet type of obstruction constipation. And if these patients don't get treated, they can run into more of a problem. They can have abdominal pain, bloating, decreased appetite, nausea, sometimes vomiting, and therefore they don't eat much. So when they eat less, they start losing weight, they run into trouble with poor nutrition, and sometimes they have intestinal megacolon and intestinal obstruction, and at other times when they are constipated, they have to push really hard, and this can lead to bleeding in these patients.
Okay, you partially answered my next question. What could be the consequences of constipation?
Right. As I said before, the main problem with the constipation is a feeling of bloating and abdominal pain, decreased appetite and nausea. And some elderly patients are quite focused on their bowel movement. They note the frequency of their bowel movement, so this could lead to anxiety. And I have had some patients who, if they have a bowel movement in the morning, daily, then they would notice that the rest of their day goes very well. And if they don't have a bowel movement in the morning, they could be disturbed for the rest of the day. So it does have a emotional component to it as well.
Okay, how can constipation be managed in a Parkinsonism patient?
The few things which patients could do, such as exercise, healthy eating, and proper fluid intake is very important when it comes to constipation. The exercise is the most important thing, and exercise could be very simple, such as walking daily on a regular basis, or doing gardening, or bicycling, tai chi, Zumba, or treadmill. Different people like different type of activities, and exercise helps them to overcome this trouble of constipation. With respect to healthy diet, the eating on regular time, not skipping any meals, and establishing regular bowel habits. After meal time, about half an hour after meals, patients should go and try to have a bowel movement. Sit, even if they don't have bowel movement in the beginning, they should try to establish the bowel habits. And once they do this for several days, they may start having a feeling or an urge to have bowel movement. Change in diet, adding more fiber, as well as more fruits and green leafy vegetables, prunes is also helpful. Dates are good, as well as cereals and rice also add to the bulk of the diet. The fluid intake also plays an important role in the management of Parkinson's disease. These patients should drink at least 4 to 6 glasses of water every day. Senna tea and prune juice are helpful. Also, if they take warm liquids, especially in the morning, that also helps to start the bowel movement.
Very good, doctor. What could be the other causes of constipation in a Parkinsonism patient?
Before we move on to other causes, I'll just touch a little bit about the medications.
Okay.
So we see these patients, and we screen them at every follow-up visit. This should be the part of routine screening of Parkinson's disease patients, because the treatment begins with education. That's my belief. So we screen these patients. We ask them the frequency of bowel movement, and how much they have to push, and how much disturbed they are by not having regular bowel movements. So if these strategies, which I was just talking, they don't help, then we move on to more interventions, such as using Metamucils and Colace, which is a stool softener. It's quite helpful. The Senacot, lactulose, and sometimes these patients may require enema. Occasionally they may have to go to ER because they didn't have bowel movement for several days, and other patients could combine these methods together and see what is good for them. As I said, every patient is individual, and one thing which works for one person may not work for the other person. So they have to find their own way, what is good for them, and if they combine these things, it does help them to overcome the problem of constipation. With respect to other causes, as you were asking, because these patients are elderly, so with age the frequency of bowel movement does decrease. So that's one common factor. And of course, if they are not drinking ample amount of fluids, or their diet is not with the bulk and fiber in fruits, in addition, lack of exercise could be cause of constipation. In these patients, if we rule out all these factors, and if they have any sudden changes, such as a sudden change in bowel movement, or if they have bleeding or abdominal pain, or a quick onset of any systemic symptoms, then these patients should be screened very thoroughly for any systemic diseases, such as uh, bowel malignancies, and any other abdominal masses could cause constipation. So there are some serious causes, and they should have a stool testing, and they should maybe discuss with their family physician to have a colonoscopy. I think there are some guidelines for colonoscopy, that after certain age, patients should have a regular colonoscopy in case if they have any serious cause, and that could be investigated and treated early on.
Yeah, I imagine Parkinsonism patients are treated the same as far as colonoscopies, when it should be and should not be done. There's no, well, we won't go into the fact that any incidence of increased colon cancer in Parkinsonism patients. I think they're probably treated like most patients when it comes to colonoscopy.
Right.
So anyways, doctor, thank you very much for a good general overview of constipation and Parkinsonism patients, and we'll continue in our nightly series of education with Parkinson. As the doctor said, education is the first part of treatment.
Sure. Thank you very much.
Good evening.